Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on COVID-19 for the week of July 19th, 2020. As we have been following, this was a disease that was essentially unknown before January of this year. In January, the world hit 100 deaths. By February, it hit 1,000, over 5,000 by March, over 100,000 by April. And the number has been growing ever since, hitting 500,000 by the end of June and continuing to grow since then, such that to date, 605,000 deaths around the world and 14,000 confirmed cases. Now, a colleague of mine in France, Dr. Marc Arzrouni, has taught me to think about the epidemic in an interesting way. He talks about a mature epidemic. What they see in a number of European countries is that after a very, very fast growth rate, the growth rate slows down considerably, approaching zero. This is what he calls a mature epidemic. But if you look at the world, we don't see that. We do see a similar pattern, but you see it's not getting down to zero. It's still growing. And the reason for that is that we aren't seeing just a pandemic that hit everywhere all at the same time. What we're seeing is a series of pandemics, each of which is moving towards a mature phase. So what I'm going to do is I'm going to pick the three most populous countries in Western Europe, Eastern Europe, Africa, Asia, North America, and South America, just to pick countries. Except I'm going to replace China with the fourth largest population, that's Pakistan. The reason is I don't have confidence in the data on death rates that we're getting out of China. But if you look at all of these global regions, what you see is tremendous variation in the amount of growth that we've seen in the number of deaths over the last month. In Africa, it's almost doubled, almost 100% growth in those three countries. The same in Asia. On the other hand, Western Europe, very little growth. Eastern Europe and North America, moderate. And then the most growth of all we're seeing in South America. So the way to think about what we're seeing is multiple epidemics evolving in different places at different times. Clearly, it hit Western Europe first. It's evolved most there and is coming along in other places. And that, by the way, is where the U.S. is. And that brings us to the second part of this talk, and that is looking at the United States for deaths per million. The first death in the United States was reported in early March. We got to 400 by late March, almost 10,000. Actually, we passed 10,000, passed 50,000 in April, and the number has been growing ever since, such that we've now have had over 142,000 deaths in the United States, almost 4 million confirmed cases. And again, as I've said every time, it's really important to understand that we're talking about a serious disease. In the first 6 months of this year, you would have expected this many deaths, more or less, from the 10 leading causes of death. COVID-19 would be right there as the third leading cause of death in our country. And as you can see, there has been a sort of an inexorable growth rate. The number of cases grew quickly and then slowed down and then grew again. If you look at the cumulative deaths by percent, early on there was a very rapid growth rate. Then it started to slow down. Then it picked back up again. And so we've been running a fairly consistent growth rate. If you look at the deaths per million, again, you can see the daily deaths went down and then have started to come back up again. The same is true with hospitalizations. Early on, their growth rate of hospitalizations was very, very high. Then it seems to have stalled out and is now growing again. So the U.S. has a pattern that looks a fair amount like a mature epidemic, but again, it's not getting down to zero either. And the same reason we're seeing multiple regional pandemics. Obviously, if you look at new cases, it looks like there's a lot more in the Southeast and the South. But let's do the same exercise. Let's pick the three most populous states in the Northeast, the Midwest, the South, and the West, and look at how much they've grown in the past month. And what you can see is the Northeast has shown relatively little growth. That was where it hit first. The Midwest is sort of in the intermediate, and then the South and the West are both growing considerably. Just for interest, if you look at Tennessee and Virginia, Tennessee is actually among the worst, even has grown even more in the past month than Florida, and Virginia is also worse than other parts of the country. There's a great deal more information about COVID-19 on our website if you want to go there and browse through the different videos, or if you have any specific questions, please let me know. I'd be happy to try to find an answer for you. Thank you very much.